Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficent and the most merciful. Today we will discuss the topic of the liver pathology, nodules and the tumors of the liver. The topic of oncology. Oncology related to the tumors and the cancerous-like structures. Here, my name is Dr. Fakhar Hayat and you are watching our YouTube channel Medicos Fever. Thanks to Dr. Sarah Khan, Assistant Professor of the Pathology. Firstly, we will discuss about the types of the nodules and the tumors of the liver. There are three types of the nodules and the tumors of the liver. Firstly is the focal nodular hyperplasia. Nodule like, here it is a liver, and specific nodules like hyperplasia is called as the focal nodular hyperplasia. Then the benign neoplasm means the cancerous or the neoplasm is the benign. They cannot be growing into the cancerous like. But in case of the malignant, tumor is spreading to the other sides. In case of the benign, the tumor is not spreading and not infected the other types of the organ, and here this is the mainly static on that side. That is why benign neoplasm. And in case of the malignant, they are moved towards the other sides, and here the structures of the other areas. This is the normal liver, and this is the cancerous like. Here you are seeing the nodules types and the cancerous like structure. Firstly, we will discuss about the focal nodular hyperplasia. In this case, multiple or solitary, single or multiple hyperplastic hepatocellular nodules, they develop in the non-cirrhotic liver, are called as the focal nodular hyperplasia. This may be arise from the hepatic parenchymal blood supply. The most important is the gross feature. In case of the gross feature, if we cut it about the morphology, we will discuss about the well demarcated areas. Here this is the well demarcation and poorly encapsulated nodule with central gray white. Here you are discussing about the central gray white. Here this is a central gray white, and this is on the peripheral side. This is on the peripheral side. Here on the peripheral side, the fibrous septa radiate. This may be the central gray white due to hepatic stellate cells. What are the function of the hepatic stellate cells? They mainly store vitamin A, but in case of the formation of the they also release transforming growth factor beta. That's why that can lead to the formation of the fibrous formation and then leads to the scar type. That's why this is the gray white depressed, central gray white depressed, and the stellate scar, formation of the stellate scar, and fibrous septa radiate towards the peripheral side. Now we are discussing about the focal nodular hyperplasia. Now we are discussing about the benign neoplasm. In case of the benign neoplasm, they may be of the two types. Number one is the cavernous hemangioma, other is the hepatic adenoma. In the name representing cavernous like cave-like structure, and hemangioma means heme related to the blood. Then accumulation of the blood in the cave-like structure and accumulation of the blood in the nodules in the here I want to discuss cavernous hemangioma is the large cave or hollow cavity, then the cavernous like lesion, and the large spaces are filled with blood. Here you will see this is the non-capsulated. This is the, here you are seeing area. This is the liver, cross section of the liver, and that's the blood. And in the cave-like structure, and the blood fluid is accumulated in the cave-like structure. This is called as the cavernous hemangioma. You will see here the typical example. Microscopic feature, you are watching, this is the lobule, hepatic lobules, and mainly these are the hepatocytes, and this is the large containing blood vessels. This is the blood. Here this is the blood, and mainly this is the hepatic parenchyma. But now the pathology is basic. We are seeing about the large spaces containing with the blood. This is the mainly, this is the blood in the specific cavity or the cave-like. That's why the name is the cavernous hemangioma, and separated by dense fibrous tissue. This is the fibrous tissue. Here you want to see the pale-like color, the pale-like. That's why this is called as the fibrous septa between the two blood accumulated in the channels, in the vascular channels, and this is the fibrous septa. Now the most important is the hepatocellular adenoma. We are discussing about the two things. Number one is the cavernous hemangioma, other is the hepatic adenoma. Now we are discussing about the hepatic adenoma. In case of the hepatic adenoma, I will discuss about the benign neoplasm developing from hepatocytes are called as the hepatic adenoma. Occurs in young women because of the excessive estrogen. Because of the excessive estrogen leads to the hepatocellular adenoma and strong associated with the use of the oral contraceptive. In case of the oral contraceptive, they are mainly ingesting the estrogen and the progesterone level, and oral contraceptive may contain of the progesterone and the estrogen. That's why this is the anabolic steroid. That's why it occurs in the young women and others with the using of the oral contraceptives women. Women who are using the oral contraceptive, they may excess production of the estrogen that can lead to the hepatocellular adenoma. That's why it occurs mainly in the young woman. This is the typical example. This is the normal gross feature. Here, this is the hepatocellular adenoma. Resected specimen showing well-defined tan mass. This is the tan mass. This is a tan mass in the liver. This is the hepatocellular adenoma. You will see hepatocellular adenoma. Hepatocellular adenoma may be caused by these factors. Number one is the genetic deficiency and the mainly hepatic nuclear factor 1 alpha inactivated hepatocellular adenoma. Number one, this is the molecular subtype. This is the inactivated hepatocellular adenoma because of the this mainly due to the because liver is synthesizing the fatty acid, and excessive of the fatty acid may lead to the hepatocellular adenoma. You want to see about the microscopic feature. If you want to see about the macroscopic feature, the fatty acid may give the white appearance. That's why, because they are washed out from the EN stain. That's why you are seeing about the this is the signature appearance. As you know about the in macroscopic feature is if it's the signature appearance, then is a accumulation of the fat. Other is the beta catenin activation, as the other is the inflammatory hepatocellular adenoma because of the inflammatory filtrates. That's why there are three types of hepatocellular adenoma. Number one is the hepatocyte nuclear factor 1 alpha, and they are producing as we see about the production of the fatty acid, more and more fatty acid. And inflammatory hepatocellular adenoma, beta catenin activated, because beta catenin is mainly inactivated. Beta catenin, they mainly stimulating, they mainly maintaining, but in case beta catenin activated, they may lead to the hepatocellular adenoma. Three things we have discussed topic wise. Number one is the liver fatty acid production as HNF1 alpha, and other is the beta catenin activation. Third is the inflammatory response. Here this is the inflammatory response. We have discussed about the benign neoplasm, but in case of the malignant neoplasm, malignant type of the cancer, and the cancer is spreading towards all of the liver area, involving whole of the liver and metastasis to the other organ. Number one is the hepatocellular carcinoma, cholangiocarcinoma. What is the cholangiocarcinoma? Cholangio means related to the bile duct. That's why if it involving the bile duct, that's why called as the cholangiocarcinoma. This is the hepatoblastoma. Hepatoblastoma is mainly related to the childhood hepatocellular tumor, and angiosarcoma is related to the formation of the gland-like structure. This is the hepatocellular carcinoma, mainly more occur in male than female. Ratio is 3:1. This is the whole involving the liver. Causes of the hepatocellular carcinoma may be due to the hepatitis B virus, hepatitis C, alpha toxins, cirrhosis, alcohol, anabolic steroids mainly the estrogen and progesterone, and the hemochromatosis, accumulation of the bilirubin, other things. Genetic pathway to the hepatocellular, because these are the mainly our cell is regulated by the some pathways P53, PIKCA and beta catenin gene. If they are mutation in these factors, that can lead to the carcinoma. Gross morphology, they may be unifocal, multifocal, and the diffused. Unifocal, multifocal, but we are discussing about a gross picture of hepatocellular carcinoma. Liver removed at autopsy showing here. This is the typical example of the hepatocellular carcinoma. You are watching about here. This is the hepatocellular carcinoma. Hepatocellular carcinoma, hepatocellular carcinoma. This is the normal, but in case here is the hepatocellular carcinoma. Hepatocellular carcinoma. You are seeing about serum alpha protein may be raised, and the greenish yellow hue. This is a greenish yellow hue, and that's the hepatocellular carcinoma. Hepatitis B virus, C virus, alpha toxin B. That's why that may leads to the hepatocellular carcinoma. Microscopic pre-malignant changes in the malignant. Number one, large cell change. In some cases, large cells are produced. Hepatocytes may becomes large. In some cases, hepatocytes may be reduced. Their size is reduced. That's why small cell change, dysplastic nodule. In case of the large cell change, we are hearing to see the large cell change. In case of the large cell change, this is the large cell, and here this is the atypical, mainly the atypical nuclei, and that's why this is the large cell. In case of the small cell, here you are watching about the small cell, and nuclear to cytoplasm ratio is reduced here. Nucleus to cytoplasm ratio is reduced here. Gross feature, in this case, nodules in the nodules. Here nodules in the nodules type. Histology, the region with the box show hepatocellular carcinoma. I wanna just discuss about the. This is the mainly. These are the hepatocytes. But hepatocytes may be a formation of the spaces. This space, pseudo-acinar space. These are the hepatocytes around it. And these formation of the pseudo-acinar space between the hepatocytes. And here in this case, you wanna see these are the hepatocytes, but in case this is the hepatocyte and this is the nucleus and prominent nucleoli. This is the nucleus, but this is the prominent nucleoli. And the moderately differentiated hepatocellular. This is the poorly differentiated. But in this case, we are discuss about the. Firstly, we will discuss about the focal hyperplastic. Number second is the benign. Now we will discuss about the malignant. In case of the laboratory evaluation, firstly we will do the CBC, complete blood count, then the electrolyte, liver function test. Liver function test may be ALT, AST. ALT means alanine transferase, aspartate transaminase. Coagulation studies. Why we coagulation studies? Because liver is producing the coagulase enzyme, factor 3, factor 7, factor 10 for the coagulation, and there is a compromise of the coagulation. That's why we discuss about the coagulation studies. Then PT, prothrombin time, activated partial thromboplastin time, then the alpha fetoprotein determination, that means the chance of the carcinoma. Imaging and the biopsy. Biopsy is the major important for the determination of the cancer. Treatment may be involved if the small tumors may be involved surgically and macro radiations with the good outcome. But the most important treatment plan is the liver transplantation is a better opinion. Radiofrequency ablation and the chemo immobilization is most important. Prognosis may be how would you discuss if someone is losing weight. If someone is losing weight, this is called as this process is cachexia, because if someone is losing weight if in 1 month they may lose the weight of the 10 kg, this is not a good normal thing. That may lead to cancer. That you may prognosis toward the cancer. This is a cancer patient. Typical example, if you wanna thinking about the cancer, gastrointestinal or esophageal variceal bleeding, liver failure with hepatic coma, rupture of the tumor may leads to the fatal hemorrhage. Sometimes tumors may be ruptured, then the internal bleeding may leads to the coma, then leads to the death. Last but not the least is the cholangiocarcinoma. We have discussed what is a cholangio means that the bile duct, carcinoma of the bile duct, that may be intrahepatic and extrahepatic. Intrahepatic means the bile ducts in the hepatocytes, and extrahepatic means outside of the liver and related to the bile duct, bile duct and the gallbladder. Important risk factor is the clonarchis, which is the most important. This is the clonarchis. This species, this microorganism is involved in the cholangiocarcinoma is the clonarchis. Extrahepatic cholangiocarcinoma and the intrahepatic cholangiocarcinoma. This is a typical example. Multifoci. This is the mainly you wanna discuss about the gross morphological multifocal. This is a many focal point. Multifocal. This, and mainly involved by the fluke. This is the Clonorchis sinensis. This is the mainly here we discuss about the malignant glands in the sclerotic stroma. This is the malignant glands that we all discuss about the carcinomas of the liver. Now in case of the summary, I would be discuss about all the details of it. In case of the summary, we will discuss we have discussed about the focal. Number second is the benign, then is the neoplasm. I want to be show with yourself is that of the, that's why it's this is the focal nodular hyperplasia. Then we will discuss about the benign neoplasm. In case of the benign neoplasm, we have discussed cavernous hemangioma, then the hepatocellular adenoma. In case of the malignant, we have discussed hepatocellular carcinoma. It's poorly differentiated, well differentiated, and the moderately differentiated. Then we will discuss about in the malignant neoplasm is the cholangiocarcinoma, the carcinoma of the bile duct. Here the bile duct involved, that's why it's the cholangiocarcinoma. Then we discuss all the focal nodular hyperplasia, benign neoplasm, and the malignant neoplasm. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicosphere, and remember us in your prayers. Allah Hafiz.